Thank you, Professor Zhang, for the introduction. And dear Professor Zhang and Professor Wang, dear Karinika and Liu and Meng. And it's a great honor for me to have this opportunity to introduce the NPJ Cardiovascular Health Journal. The aim and scope of this journal is stated here. This is an open access international peer-reviewed journal dedicated to publishing the highest quality research relevant to all aspects of cardiovascular health research. We consider research that explores the causes, prevention, and management of cardiovascular diseases by using clinical trials, observational studies, or basic and translational research. So you can see here that nearly all aspects of research regarding cardiovascular health diseases are welcomed by this journal. And as shown here, the journal covers a broad range of topics regarding all kinds of cardiovascular and circulatory diseases, such as the risk factors of cardiovascular disease, the translational basic science, the lifestyle intervention, pharmaceutical treatments, public health and policies of prevention, or health economics study. All these topics are welcomed. As most of the journals, we consider several types of articles. The full article, that means the original research article, and we also publish comments, consensus, and statement and guidelines are also considered, and also editorial from our editorial board members. And matters arising, that means it's regarding important scientific comments and the clarifications of peer-reviewed articles published in the journal. And also we publish perspectives and reviews. So far we have 7 associated editors, Julia from Australia, and Professor Ma Xinliang from United States, and Dr. Wang Minxian, he's from Beijing Institute of Genomics. Dr. Wang is here, and Clara Chow from Australia, Dr. Zhang Yan, he's here, Nathan Wang from United States, and Oleg Aslandi from United Kingdom. We also have 2 advisory editors, who is Karina Hong. She is a senior editor from Nature Review Cardiology. As Karinika just mentioned, that we accept a large proportion of transferred manuscript from these journals, Nature Reviews Cardiology, and also Nature Communications. So we have another advisory editor from Nature Communications. Our journal is quite successive in organizing collections. So far, we have organized 12 collections, and 7 of them are still open for papers. And as you can see, we have very interesting topics such as the clinical care and patient-centered interaction using artificial intelligence and machine learning. And this area is very, very hot, and we received many submissions in this area. And also we have a similar collection, which is the digital health technology and evolving paradigm in the transformation of cardiovascular health. So you can see both of these collections are regarding artificial intelligence and digital health. And yes, this is a hot topic, hot area. As you can see, many talks are regarding this kind of studies in this Congress also. And also we have an open collection for the advances in percutaneous therapies in cardiovascular medicine. And another one regarding public health, that is the disparities in prevention of cardiovascular disease, such as ethnic background differences and racial differences, or gender differences, or urban and rural differences. These are all considered in this collection. And also we have the collection regarding basic science, which is the mechanism of cardiovascular regeneration. And another one is also a hot area. It is about the novel drug targets for cardiovascular research. And we have a collection organized by one of the associate editors, Clara Chow from Australia. She is an expert in women's health, so she leads a collection on women's cardiovascular health through their life course. And another open collection I have introduced regarding artificial intelligence and digital health. So these are the 7 open collections. If you have any submissions, papers, manuscripts in these areas, please do consider to submit it through this scan. You can scan this, and you can see the detailed introduction. So as Klinika mentioned just now, the Nature Partner Journal are quite influential by its nature of open access, the strong background in Nature portfolio. So we have a website in the Nature website and Twitters. Also based in China, some of our publications can be introduced by the WeChat, the Nature WeChat official account. So this offers full open access and more inclusive Nature journal choice. And our editors are from all over the world, so this the message can be distributed very fast. I think you might be interested in the metrics of this new journal. Since we have just 2 years of experience, we started last year, and this is the 2nd year of this journal. And some of the papers are quite amazing in its influence. So, for example, this paper published just 3 months ago, it has more than 1,500 downloads and 4 citations. And this one published in March this year was accessed more than 3,000 times and 2 citations. And this one published in early January have got 6 citations. So just within a few months, that's I think quite good metrics for these articles. How about the indexing? Everybody will be interested in when this journal can be index have an impact factor. And so far, NPJ cardiovascular health has been indexed in Baidu, CNKI, DOAJ, Google Scholars, and we have submitted to the PubMed Central. And maybe later this year, we will submit application to Web of Science. So hopefully we will have index, we will be indexed next year by PubMed Central and the Web of Science. And these are some performance metrics of NPJ cardiovascular health. I think by the support from all our editors and associate editors, our manuscripts submitted to this journal handled very successfully. The submission to first decision, the median time is only 9 days. That means within 10 days, you will get the first decision, whether it is death rejection or send out for the peer reviews very fast. And then the submission to acceptance, the median time is 138 days. And as a new journal, we give much more opportunities for the submissions to be sent out for external review. As shown here, 82% of the submissions have been sent out to peer reviews. That means your submission will be given more chance to be considered by a group of reviewers, and not only by the handling editors. And we also accept a large proportion of transferred manuscript from the Nature portfolio. That about 12% of all submissions came from Nature portfolio journals, such as Nature Communication and APG Digital Health, or this kind of journals, Nature NPJ Digital Medicine, and also Nature Cardiovascular Research. I think NPJ Cardiovascular Health is a very international journal, although I'm a doctor from China. But you can see here, our submissions came from 29 countries and regions in the world. And last year, in the beginning, 35% of our submission came from China, and 25% from United States, 18% from Europe, and 22% from the rest of the world. But this year, the proportion from China decreased from 35% to only 25%, while those from United States increased from 25% to 32%. And the submissions from Europe and the decreased a little bit, but submissions from the rest of the world increased significantly. I think that means our journal became more international representative and influenced. Because in the beginning, as an editor-in-chief from China, I invited more Chinese experts to submit papers. But now we are developing very healthy, so we attract more submissions from the rest of the world. And regarding the acceptances, you can see here, last year, more than 40% submissions from China were accepted. 40% of accepted papers from China and 25% from United States. But this year, the proportion from China decreased significantly, while from the United States increased, which also means the international influence of this journal. And compared with the acceptance and the submission rates, you can see there's no priorities for submissions from China. And we use the universal criteria for all the submissions. And the only aim is to accept qualified novel and influential articles from the world. And this slide summarizes the most important information of this journal. So in summary, the NPJ Cardiovascular Health is a high quality open access journal. It's a new Nature partner journal for cardiovascular research. And our scope is to publish research dedicated to understanding the causes, prevention, and management of cardiovascular diseases. So no matter basic science or population science or clinical science, all these studies we welcome for submissions to our journal. And I'd like to mention that yesterday we have a competition for the best English oral presentation yesterday afternoon in the Great Wall Congress. And we have selected the best oral presentation in English for clinical research, and one best presentation for population research, and best research for the basic research. So I think all these activities improve the influence of our journal and the quality of our submissions. And you can see the topic include all aspects regarding cardiovascular disease and all types of articles. And we have a variety of disseminated methods to have your publications more likely to be cited. So if you have any other queries, please contact us. This is the email address for Krunika. If you have any questions, you can also send queries to the Nature email address, and this is our website. So thank you very much for coming to the session. Thank you, and please consider to submit your research to this promising journal. Thank you.